students, I welcome all of you to the 5th module of revision in dermatology. In this particular module, we're going to be looking at number 1, ichthyosis and genodermatosis. Number 2, skin in connective tissue disorders. Number 3, skin in systems and skin malignancies. Number 4, cutaneous adverse drug reactions. And number 5 would be some miscellaneous topics. First, we look at genodermatosis. Now, the term genodermatosis means genetic disorders with skin lesions. First, we'll take up neurofibromatosis type 1, which is also referred to as von Reckling-Hausen's disease. The inheritance of this condition is autosomal dominant. The skin features of NF1 are as follows. First, we get cutaneous neurofibromas. Now, what are neurofibromas? Neurofibromas are benign tumors of the connective tissue of the peripheral nerve sheath. So, benign tumor of the connective tissue of the peripheral nerve sheath. And here you're going to get skin-colored papules and nodules, multiple skin-colored papular nodules. Next, we have a special type of neurofibroma called as plexiform neurofibroma. So this is going to arise from multiple nerve fascicles. Multiple nerve fascicles. So the onset of this plexiform neurofibroma is congenital, whereas cutaneous neurofibromas are generally seen during adolescence. The lesion presents a diffuse enlarging mass. Palpation is a bag of worms palpatory feet. We take up the second manifestation here, which is going to be in the form of these hyperpigmented macules. These hyperpigmented macules, which are seen in NF1, are referred to as cafe-ole macules. In the diagnosis of NF1, we should have 6 or more cafe-ole macules. The size should be more than 5 millimeters in prepubertal individuals, more than 50 millimeters in post-pubertal individuals. We go to the third finding in the form of skin fold freckles. So you can see multiple hyperpigmented freckles. And when they're seen in the axilla, we call it as axillary freckling. Axillary freckling is also known as Gross sign. And please remember, students, Gross sign is pathognomonic of NF1. Pathognomonic or NF1. The next important lesion to remember here is Lish iris nodules. So we can see Lish iris nodules here. So pigmented iris hamartomas. Pigmented iris hamartomas. Next condition to remember is tuberous sclerosis complex, also known as Bone-Wills disease, with the autosomal dominant inheritance. The triad of tuberous sclerosis complex is called as epiloia, where EPI stands for epilepsy, LOI stands for low intelligence, and A stands for adenoma sebaceum. This triad is also known as triad. Now let us look at the skin features of tuberous sclerosis complex. First, we have these hypopigmented macules on the trunk. These macules are referred to as ash leaf macules. We go to the second lesion, which is also referred to as facial angiofibromas. These lesions are reddish brown papules. Reddish brown papules. Distributed over the malar area and the nose, these lesions are referred to as adenoma sebaceum. So the first one was ash leaf macule. The second one is adenoma sebaceum. The third important lesion is a leathery plaque, which is situated over the lumbosacral region. The composition of this plaque is collagen, that's why it's called as a collagenoma. This lesion is referred to as shagreen patch. The meaning of the word shagreen is leather. Next, the fourth important skin lesion is periungual fibromas. Periungual fibromas seen in tuberous sclerosis complex are referred to as Conan's tumors. We take up the third important condition, which is Sturge-Weber syndrome. Please remember, students, the inheritance of this condition is sporadic. And Sturge-Weber syndrome is also referred to as encephalotrigeminal angiomatosis. That means there is blood vessel proliferation, which can happen in the skin, eyes, and the brain. So what is the neurological manifestation of Sturge-Weber syndrome? It can have epilepsy. And then in the eye, there could be increased intraocular tension, which will be glaucoma. And in the skin, you're going to have a facial port wine stain. Now, this port wine stain is pathologically a capillary vascular malformation. It usually starts at birth, and it is always permanent. It does not disappear. The treatment for this facial port wine stain, which you can see here, is going to be a very important laser called as pulse dye laser, because this is one laser which targets the hemoglobin, which is there in the blood vessels. Next, we move on to ichthyosis. Now, ichthyosis is a disorder of keratinization. The feature of ichthyosis is the presence of fish-like scales with no inflammation being present. Let us now look at congenital ichthyosis in the form of first disease, which is ichthyosis vulgaris. It's an autosomal dominant disorder. Filaggrin is the protein which is involved here. The function of filaggrin is filament aggregating protein. The scales in ichthyosis vulgaris, as you can see in the image, are fine and white scales. We go to the next form of congenital ichthyosis. This is called X-linked ichthyosis, also known as ichthyosis nigra. The inheritance of this condition is X-linked recessive. The defect here is that steroid sulfatase which is responsible for the conversion of cholesterol sulfate to cholesterol. So once there is a block here, cholesterol sulfate concentration goes on increasing. And the scales are called brown to black scales. That's why this condition is referred to as ichthyosis nigra. Two important disorders associated with X-linked recessive ichthyosis. Number one, from the letter C, you have corneal opacities. And number two, we have crypt orchidism, which is going to be associated, which is undescended testis. The third important disease here is lamellar ichthyosis, which is autosomal recessive condition. The defect is in epidermal transglutaminase 1. At birth, what happens is the child is born by a translucent particle which covers the entire body of the child, and this is referred to as collodion membrane. And then what happens after some time, the membrane gives way. And when it gives way, you get dark, plate-like adherent scales. Please remember, students, that's why this condition is called lamellar ichthyosis, because lamellar means plate-like. And the scales are adherent, so dark, plate-like adherent scales. Two important associations to remember for lamellar ichthyosis is number one is outward turning of the eye is called as ectropion, number one. Number two, the outward turning of the lip is referred to as eclampsia. We now move on to the next condition called as xeroderma pigmentosum, which is a disorder of DNA repair, autosomal recessive inheritance. The defect here is the nucleotide excision repair. So this is a mechanism which removes the damaged DNA, which is sunlight induced. If this enzyme mechanism does not work, what happens is the damaged DNA accumulates and results in genomic instability and carcinogenesis. So what cutaneous lesions you can get? Number one, you can have photophobia here. Skin, you can have freckles. And here you can see the presence of a malignancy, a basal cell carcinoma. You get skin cancers. Very, very commonly in this condition. The cutaneous lesions, you get xeroderma. You get a lot of dryness in this condition. Let's take up the next topic on skin and connective tissue diseases. First, we have lupus erythematosus. In acute cutaneous lupus erythematosus, this is also known as malar rash or butterfly rash. The symptom here is going to be photosensitivity. Is going to be erythema over the malar area. It is the bridge of the nose. So, you generally involve the bridge of the nose, and the area which is spared is the nasolabial fold. So, in chronic cutaneous lupus erythematosus, the most common form is DLE, which is discoid lupus erythematosus. The important sites are face is involved, scalp is involved, and ear is involved. So if you look at a patient with discoidally, you're going to have a discoid plaque, which is a disc-shaped lesion. You can get a lot of discoid lesions. The center shows atrophy plus scarring, a lot of atrophy and scarring. Periphery shows hyperpigmentation. The scales in DLE are called as adherent scales, and the type of alopecia which you get in DLE is called as scarring alopecia. Next, we move on to dermatomyositis. It's an autoimmune connective tissue disease which involves skin and skeletal muscle. The type of muscle involved is proximal muscles, resulting in proximal myopathy. Let us now discuss the skin lesions of dermatomyositis. Number one, you have the bilaceous flat top papules distributed over the MCP joint and the IP joint. These are referred to as Gottran's papules. So this is number one. Number two, we have a bilaceous macular erythema, which is located periorbitally, more over the upper eyelid. This rash is referred to as heliotrope rash. Helios means sun, tropism means having an affinity. This is number two. Next, we have the presence of hyperkeratotic fissures, which are located over the tips and the sides of the digit. This is the third important skin lesion called as mechanic's hand, which looks like the friction which a mechanic encounters while working with the tools. And lastly, you have this vivacious macular erythema, which is located over the upper shoulder and the back. So this is going to be called as shawl sign. Scleroderma is classified based on its involvement into skin involvement or skin and systemic involvement. If only skin is involved, we call it as morphia. If skin and systems are involved, we call it as systemic sclerosis. The other name for morphia is localized scleroderma. Let us look at the clinical feature of morphia, where the patient is going to present with a bilaceous indurated plaque. Now we look at a specific variant of morphia, which is characterized by a linear pattern of scarring alopecia. So you have a linear pattern of scarring alopecia. What does this pattern resemble? It resembles the cut of a sword, a saber sword. That's why this alopecia is referred to as N-Cody saber, secondary to morphia. We now move to the histopathology of morphia. In morphia, what happens is an abrupt transition between the normal and the affected skin, and this happens because of the presence of a firm dermis due to increased collagen in the skin. So during this, what happens when you try to take a biopsy of a morphia lesion, the edges of the dermis appear squared off, and this gives an appearance of box-like pattern to the dermis, and this is called box-like appearance. Now here you can see the squared off edges of morphia with a lot of collagen fibers which are deposited here, and this resembles a box-like appearance. That's a very characteristic feature of morphia. We now move on to the classification of systemic sclerosis, which is broadly divided into limited cutaneous systemic sclerosis and diffuse cutaneous systemic sclerosis based on the skin thickening. If the thickening of the skin is distal to the elbow, distal to the knee, the elbow, proximal to the knee, and then because it is diffuse cutaneous systemic sclerosis. Limited cutaneous systemic sclerosis is also referred to as CREST syndrome. Now, students, what is the full form of CREST? C stands for calcinosis cutis, deposition of calcium in the skin. R for Raynaud's phenomena. E for esophageal dysmotility. S for sclerodactyly, and T for telangiectasia. Next, we move on to the facial features. You get a mask-like faces here. You have a pinched nose, perioral presence of furrows, and the aperture of the mouth is smaller, which is called as microstomia. This happens because of the fibrotic process which is involving the skin over the face. And then you can see the presence of multiple telangiectasias, which is referred to as mat-like telangiectasia. The characteristic pigmentation of systemic sclerosis is called as salt and pepper pigmentation, because there is both normal skin as well as depigmented skin which is present together. This is called as salt and pepper pigmentation. Next, we move on to the topic of Henoch-Schönlein purpura, which is an example for IgA vasculitis, and this is an example for small vessel vasculitis. The characteristic lesion of Henoch-Schönlein purpura is going to be symmetrical palpable purpura over the lower extremities. But please remember, students, that platelet count is going to be normal. Please don't make a mistake. There is no thrombocytopenia. Platelet count is normal. Next, we move on to reactive arthritis, which is an inflammatory arthritis which results secondary to a distant focus of infection. There are two important skin lesions to remember. Number one, you have a painless circular shape erosions which is happening over the glans penis, and these are referred to as circinate balanitis. And number two, we have hyperkeratotic papules and plaques over the palms and soles. There's keratoderma blenorachicum. Kerato means thickening, derma means skin. So you have hyperkeratotic papules and plaques over the palms and soles. Next, we move on to the chapter on skin and systems. Erythema nodosum is an example for septal paniculitis. Erythema nodosum is an example for septal paniculitis. How does the patient present? You have red, tender nodules, anterior aspect of the leg, heals without scarring. The most common cause is idiopathic. The most common infection which can trigger erythema nodosum is group A, streptococci. Look at this case scenario, students. So there is a patient with fever, bilateral hilar lymphadenopathy, arthritis, and erythema nodosum. Which condition I should think about? Yes, the correct answer for this condition is Löfgren's syndrome. This is an acute form of sarcoidosis. So Löfgren's syndrome composes of fever, bilateral hilar lymphadenopathy, arthritis, and erythema nodosum. Next, we move on to acanthosis nigricans, where the patient is going to present with hyperpigmented velvety plaques. So these are the hyperpigmented velvety plaques which can be distributed over the axilla and the nape of the neck and the sides of the neck. The most common cause is obesity. That's very important to remember. Next, we move on to granuloma annulare. So this is an example for a necrobiotic disorder. What is the meaning of the word necrobiosis? Necrobiosis means collagen degeneration. Collagen degeneration. Now, if you look at the morphology of granuloma annulare, you can see the annular arrangement of the lesion. So you have annular arrangement of papules. Where are they distributed? On the dorsum of the extremities. The most important association to look for is going to be diabetes mellitus. The next condition to discuss is necrobiosis lipoidica diabeticorum. How does the patient present over here? You get a waxy yellow plaque. You can see this waxy yellow plaque. So when I say yellow, lipoidica means lipids are depositing in the skin. The surface of this lesion shows telangiectasia. So you can see the dilated blood vessels on the surface of the lesion. The site is going to be on the anterior aspect of the leg and associated with diabetes mellitus. That's why this condition is called necrobiosis lipoidica diabeticorum. Next, we move on to peripheral mixed edema. The patient is going to present with non-pitting diffuse edema. So you can see this non-pitting diffuse edema distributed over the anterior aspect of the leg, associated with hyperthyroidism, which is Graves' disease. That's why this condition is also known as thyroid dermopathy. Also known as thyroid dermopathy. Let us now discuss the approach to knuckle hyperpigmentation. So in the case of knuckle hyperpigmentation, if the patient has got systemic symptoms like fatigue, weight loss, and low BP, electrolyte imbalance in the form of hyponatremia and hyperkalemia, think of Addison's disease. In a patient of knuckle hyperpigmentation, if there are symptoms like pallor, glossitis, and fatigue. These are symptoms of anemia. And if there are neurological symptoms. So neurological symptoms is one of numbness, tingling, and memory issues. Think about vitamin B12 deficiency. We take up the next topic on phrynoderma. Now, phryno means store, derma means skin. That's why it's called the store skin. How does the patient present over here? You get multiple hyperkeratotic follicular papules. So, hyperkeratotic follicular papules. They're located over the elbows, knees, associated with essential fatty acid or vitamin A deficiency. So hyperkeratotic follicular papules, so the extensor aspect of the elbows and knees is phrynoderma. Next important disease is pellagra. Pelle means skin, agra means rough. So pellagra is resulting due to deficiency of vitamin B3. The diet which can promote pellagra is maize and jowar, and substance abuse associated with pellagra is chronic alcoholism. The triad of pellagra involves diarrhea and dementia. In dermatitis, always remember, it is called as photodermatitis, and this is referred to as Castle's necklace. So this is going to be called as the Castle's necklace. The second component is diarrhea, and the third component is dementia. Next, we move on to xanthelasma palpebrarum. Xanthos means yellow. That means xanthelasma is characterized by yellow color, firm, symmetric papules which are distributed in the periorbital region, mainly over the eyelid margin. It is associated with hyperlipidemia in 50% of the patients. So here we can see symmetrically distributed yellow color papules which are made up of lipid with 50% association with hyperlipidemia. Next we move to skin tumors. First we have mycosis fungoides, also known as CTCL. CTCL stands for cutaneous T-cell lymphoma. It's an example for non-Hodgkin's lymphoma. When you do a biopsy, what happens? You get a collection of atypical T cells. These atypical T cells form a collection in the stratum spinosum. This is referred to as Potrier microabscess. Potrier microabscess is the collection of these atypical T cells in stratum spinosum in cutaneous T cell lymphoma. What is Sézary syndrome? Now, Sézary syndrome is erythroderma. That means the skin involvement plus leukemic variant of CTCL. So when I look at CTCL, there are 4 stages. The 4th stage was erythroderma. But Sézary syndrome means erythroderma. That means skin is involved. Plus, with the skin involvement, the tumor cells have gone into the blood. So erythroderma plus leukemic variant of CTCL. The triad of Sézary syndrome includes number 1, erythroderma, generalized lymphadenopathy, and circulating Sézary cells. These Sézary cells have a characteristic cerebriform nucleus. Cerebriform nucleus. Next, we move to basal cell carcinoma. The 2 important features. Number 1, it's a locally invasive tumor and metastasis is rare. Because it's locally invasive, it's also called as a rodent ulcer. It's called as a rodent ulcer. Let us now look at the morphology of BCC. So it's a translucent pearly nodule with surface telangiectasia. This nodule is undergoing central necrosis, resulting in ulcer. This ulcer will have rolled out beaded margins. And as I mentioned, it's called as rodent ulcer. We now move on to the next topic on cutaneous adverse drug reaction. First, we have fixed drug eruption. Now, fixed drug eruption generally results due to NSAIDs, cotrimoxazole, and tetracyclines. And if you look at the lesion, the patient presents a circular, dusky red plaque. And on re-intake of the drug, it recurs at the same site. That is why this drug reaction is called as fixed drug eruption. And this lesion is going to heal with hyperpigmentation. So that's how a FDE heals. We take up the next topic on erythema multiforme, which is an example for a cytotoxic dermatitis. The most common infection which can trigger erythema multiforme is HSV1. Now let us look at the special lesion of erythema multiforme, which is called as target lesion. A target lesion will have 3 zones. In the center, you have a dusky zone, an intermediate zone of pale edema, and a peripheral rim of erythema. And these are the multiple targets which you can see. Zone 1, Zone 2, and Zone 3. And the distribution of these lesions is going to be on the distal extremities. So multiple target lesions which are symmetrically distributed over the extremities is very classical of erythema multiforme. Let's move on to the next topic of SJS and TEN. SJS stands for Stevens-Johnson syndrome. TEN stands for toxic epidermal necrolysis. So this spectrum is characterized by acute, life-threatening, severe mucocutaneous drug reaction. That means mucosal involvement is very, very important for the diagnosis. In terms of etiology, more than 90% of the times it is drug-induced. Number 1, we have the NSAID group of drugs, especially the oxycams. Number 2, anti-epileptic drugs. Number 3, sulfonamides. Number 4, antiretrovirals like nevirapine. And lastly, allopurinol, which is a drug used in the management of gout. Let us now look at the classification of SJS and TN based on the body surface area involved. If the epidermal detachment is less than 10%, we call it as Stevens-Johnson syndrome. If it is between 10 to 30%, we call it as SGS-TN overlap. If it is more than 30%, we call it as toxic epidermal necrolysis. Now, in terms of SGS and TN, systemic features will be present. That's why it's called as toxic epidermal necrolysis. That means TN, toxicity features will be there. And what skin lesions you're going to have? Initially, you're going to have flat, atypical target lesions. So when I use the word flat atypical target lesion, it means these have only 2 zones. In contrast to the typical target lesion, which have 3 zones, which is distal, these are mainly going to be distributed proximal extremities and the trunk. Proximal extremities and trunk. If it is not detected in time, what can happen is you can land up with this clinical feature, which is called a sheet-like epidermal peeling. And which clinical sign are you looking for?
Nikolsky sign.
Nikolsky sign will be positive here. Please remember, students, that pseudo-Nikolsky sign basically is seen due to necrosis of the keratinocytes. Necrosis of the keratinocytes, but pseudo-Nikolsky sign, that means when you put tangential pressure on the skin, you can see the upper layers of the epidermis will slide away from the lower layers. And if you look at the mucosal examination, you're going to have painful erosions covered by hemorrhagic crust, which is very, very characteristic of SJS and TN. In terms of treatment, number 1, stop the offending drug. Number 2, go for cyclosporin or intravenous immunoglobulin. Next, we move to the topic of miscellaneous diseases. Number 1 is lichen nitidus. Now, lichen nitidus is defined as a chronic inflammatory disease of unknown etiology. What is the meaning of the word nitidus? Nitidus means shiny. Let us look at the clinical features of lichen nitidus. So, there are multiple asymptomatic shiny papules. The multiple asymptomatic shiny papules, which are distributed over the forehead, forearm, penile shaft. What is important for the exam is this characteristic histopathology. So here what do we see? We see a chronic inflammatory cell infiltrate, which is compared to a ball. Then here you can see the rete ridges. Rete ridges are basically the portion of the epidermis going into the dermis. These rete ridges are being compared to a claw. So ball is being held by a claw. That's why this characteristic appearance is called as claw clutching the ball appearance, very characteristic of lichen nitidus. The next topic for discussion is Lupus marmorata. Lupus means skin. Marmorata means marbled appearance. What is this condition? This results due to a physiological response to cold, usually seen in infants, and the lesion is going to be in the form of reticular marbling. Reticular marbling here over the trunk and the extremities. And what is the change happening with temperature? It reverses on warming. The next disease is trichothiodystrophy, which is an autosomal recessive condition. Tricho means hair, thio means sulfur, dis means abnormal, trophy means growth. That means trichothiodystrophy generally results due to the abnormal synthesis of the sulfur-containing keratins, due to which there is defect in the disulfide linkages, and this is going to result in brittle and fragile hair. Here in trichothiodystrophy, we appreciate the presence of this diffuse, sparse, and the broken hairs. And when we do a polarizing microscopy of the hair, we see alternate light and dark bands along the hair shaft. This is referred to as tiger tail appearance. So if they ask you in the exam, tiger tail appearance is seen in which condition? On polarizing microscopy of the hair, it's a trichothiodystrophy. The next disease for discussion is dermatitis artifacta, which is a psychocutaneous disorder. What is the meaning of the word dermatitis? Means skin disease. Artifacta means self-induced or artificial. That means the patient is inducing this disease. So morphologically speaking, you get bizarre skin lesions. The meaning of the word bizarre is of different sizes and shape. But always remember, the erosions and the ulcers here are very, very superficial. Because when a person is hurting himself, he will try to inflict generally superficial erosions, and it's usually seen on accessible body sites. Only where the patient can inflict injuries, only such sites will be involved. Moving on to discuss this chemical compound known as MIT, which stands for methyl isothiazolinone. So this is basically going to be a preservative, which is there in liquid cosmetic and personal care products. And what is the function of this MIT? It inhibits the bacterial growth in cosmetic products. This has been asked once in a previous INICET exam. So with this, we conclude the final module of revision in dermatology. Thank you.
Genodermatosis, neurofibromatosis, heckling, house and disease, cutaneous neurofibromatosis, benign connective tissue disorder of periodontal skin colored papilla nodules, plexiform neurofibromatosis from multiple non-facial congenital diffusion and vago forms of venous, Caféolic macules, which is hyperpigmented macules, numbers more than 6 for diagnosis of neurofibromatosis 1, prepubertal more than 5 mm, postpubertal more than 15 mm. Axillary franklin, crow sign, small brown black spot, neurofibromatosis, small brown black spots, leash iris nodules, pigmented iris hamartomas. Tuberous sclerosis, bone village disease, autosomal dominant oxides, epilepsy, low intelligence, and adenoma sebaceum. Okay, done. Dun, 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 dun.